Hello, good morning. Good morning. I hope everyone enjoyed your last session. For those who I have not met yet, I am Candace Weber, Chief of Partnerships at the Louisiana Policy Institute for Children. Before we get started with this second session, just a couple of quick notes. You can chat with the speaker or myself as the moderator in the chat box. You can type your questions in the Q&A box. If you're having tech problems, feel free to chat me as well. And we will have time for Q&A at the end of the session. So please don't hesitate to put your questions in the Q&A box throughout the presentation. And so at this time, it is my pleasure to introduce this session speaker, Dr. Jordan Thibodeau. He is an Associate Director of Research at the Kathleen Babineau Blanco Public Policy Center in Lafayette, Louisiana at ULL. He oversees the research and evaluation of programs supporting the Louisiana Department of Education and the Louisiana Department of Children and Family Services and statewide initiatives such as Whole Health Louisiana and the Family Literacy Engagement Pilot. His research has been published in peer-reviewed journals of child development, psychology, education, and physical activity. He is a fellow of 0 to 3, which is a national nonprofit organization that champions infant maternal health. He has a PhD in applied developmental psychology from George Mason University in Fairfax, Virginia, but Louisiana is home. So at this time, I'm going to turn it over to our session 2 speaker, Dr. Thibodeau.
Hey, good morning, everyone. Thank you, Candace, for that introduction. And it's good to be with you. I'm going to share my screen here. Okay. Okay. All right. Well, good morning again. So I am here to present some work that was done as part of a policy brief on childcare and the economy in Louisiana. So I'll be taking you through that brief this morning. I want to start with just a little bit of background on that policy research brief and kind of how it came to be. So this was a collaboration in partnership with the Louisiana Policy Institute for Children. And the work was focused on building off of prior survey research and public policy research at LSU. So our executive director, Dr. Stephen Barnes, had been focused on this area of childcare and its local impacts. So they wanted to continue this, and this was kind of born out of that collaboration. So at the end of the presentation today, I'm going to share a copy of this. I know that the moderators and the coordinators of the conference will also share resources in the recordings of this policy brief, so it'll be available for you. So just a high-level outline of this brief that I'll be talking about today, is we're going to look at why early care and education matter, the state of early care in education in Louisiana, some economic impact issues related to the state economy, and specifically within the childcare sector itself. And then we'll close with some coverage of what happened or what was happening at the time during COVID-19 and those challenges that continue to persist. So, and I'll finally close with some higher points, some highlights to leave you. So, I don't know if anybody in the audience really needs to be convinced of this, but maybe you do. I am a developmental psychologist by training, and I'm also a father of 3 children between the ages of 0 and 3 years of age. So I have all of them in early childcare centers. paid childcare. And so I believe very much that it does matter. But the slide here is worth presenting anyway. I like to think of early child care and high quality care as being brain building. Brain architecture matters between 0 to 3, and even then within the first 1,000 days, right? We've heard certain quotes before from different researchers and advocacy groups. So we know that the benefits of attending early care and high quality care are higher IQ, improved literacy, pre-literacy skills, and quantitative skills. There's in adulthood a transition to better opportunities through higher education and overall accumulation of positive benefits. And the last bit here is, dealing with the economy. We know from some early studies, the famous Heckman study, that there's a return on investment for every bit of public funding that goes to early child care, right? So it's a pretty significant benefit overall to the nation, to children, and to the teachers and families. So in Louisiana, I'm going to present just kind of some overall landscape statistics here. Now, I should say that this policy brief was published in April 2021. There was some data that were drawn from surveys that were done as recent as 2019, but we've updated the numbers here today to kind of reflect the most recent analysis, which is our sources that we're drawing from, which are secondary data in this case, from 2021. So you can see some statistics here that Louisiana is estimated to have around 11,000 child care providers, and around 900 of those are center registered with LDOE. And the majority of children aged birth to 5 spend at least, those who are attending spend at least 10 hours per week in non-parental care. But only a third of those are in paid care. So we see that there's like a discrepancy between what types of care and what types of usage is occurring across the state. In fact, the trends from 2019 to 2021, as I pointed out from this survey data, this report from Child Care and States report, shows that there is a decline of about 6%. So, further decrease in usage of paid care. LDOE estimates that about 125,000, give or take a few, have attended early care by a provider, and those are the licensed centers there. And if you look at the census data of all children between the ages of birth to 5, that's about 2 in every 5 kids in Louisiana that are in paid early child care. The final 2 bullet points there deal with those that are receiving public support. So those are children that are eligible and who have been processed or receiving CCAP. Those include families in need of assistance, as well as children in special groups, special needs groups, such as foster children. So we know that a number of centers do receive public funding through the state to be able to provide that quality care. High quality care and education leads to kindergarten readiness, and it has a high return on investment, as was brought up in the first slide. Yet it still seems like it's out of reach for many families. So higher quality centers tend to cost more. And even though you can see in the table there, the comparison between Louisiana and the US, that Louisiana is less expensive, it is still relatively expensive to afford childcare at a center if you have an infant or if you have a 4-year-old. I myself, as I said before, can personally attest to that, that it is a significant investment in our children, and it is costly. I, of course, have talked to many of my peers in other states, and they share the same sentiment that it only seems to get more expensive. So a single parent, however, would need to spend a good chunk of their income on childcare to maintain stability with their work and with their child's needs. In fact, it's a balancing act, as pointed out by the Louisiana Policy Institute for Children's report, that many parents find it difficult to afford childcare when they are working. Now, recent statistics do point to some, I guess, glimmer that the cost of childcare is not necessarily as expensive or higher than higher education expenses, although that was the case when the data were analyzed in a previous report in 2019. Now, this includes 11 other states that are considered at higher cost, which Louisiana was compared to. But nonetheless, we do see that costs continue to affect families, and this translates in terms of opportunities for families to be able to defray that cost, right? So I brought up the comparison between university education tuition and paying that tuition versus paying childcare. There are many more options available to defray the cost of tuition in college than there are through early childcare public funding, through childcare and assistance program, Head Start, early Head Start are options, but those are limited to those, where you have more diverse options when you're talking about other forms of education like higher ed. The policy brief then goes into talking about the economic impact of the breakdown of childcare. So we took some data, and in this policy report, we took some data from 2017 that was looked at another report by the Policy Institute for Children, and updated a little bit of that data to come up with categorical losses. So absences due to loss of childcare, turnovers in the workforce, and other costs to businesses. And I mean, in terms of the overall impact, you can see it's astronomical in some senses for Louisiana. So I think this presents a pretty compelling aspect of the research, that these losses continue to kind of gain traction, and it presents a bit of a slippery slope to the investment of early child care and education. Again, I reflect a little bit on my personal experience in this, and just imagine, being, expected to go to work and be a productive adult and having to sideline, several days out of the year due to loss of childcare for whatever reason. Sometimes that in a case, it could be due to closure, such as in Louisiana when your roads are flooded and teachers can't get to work, and so children are forced to stay home. So that becomes abundantly clear whenever it's acute like that as a stressor. And overall, we see that this is a significant impact. This specifically also affects the childcare economy and the childcare sector. So there are, with the economy, being impacted by higher costs, there's a struggle for early childcare centers and directors to maintain high quality at an affordable cost. So low market rates tend to drive down providers to be able to pay their staff and offer them adequate benefits, as well as to invest more in the professional development through workers' education and training. We know that type of education and training is beneficial to the workforce, especially, as I said, with early child care teachers. They're not just workers, they're teachers and brain builders. And so they themselves, support the economy through that brain architecture that makes a bigger return on investment. But their pay is insufficient to do that. So, we know from not just from the data here, which is Bureau of Labor Statistics, which shows the average pay across state and region, but we know that the teachers themselves rate this as the most important aspect of their job, is being paid at a respectable level and then being offered a more stable career and professional credentialing ladder to stay there. Conversely, on the flip side, we know that without that, LDOE, who did a recent study on their teacher retention, has found that 35% of early educators leave after 1 year, and after 2 years, almost 60% have left. Now, you're going to hear a little bit more about some work that we're doing here at the center to look into teacher retention through a teacher statewide pilot. And we'll save a little bit for that later, but we are interested in that problem and continue to stay engaged with the Louisiana Department of Education to assist them. There was a very significant event in recent history that I'm sure everyone remembers. It's called the COVID-19 pandemic. And, it was acutely felt in the childcare sector. So it amplified longstanding challenges and persistent challenges to provide quality care and any care at all. So people were strained in that area, and it increased costs on that sector by operating costs. There was cost of safety measures and sanitation and distancing and quarantining due to staff being ill. Public health measures, changed essentially the number of seats that were available and kind of upended the traditional ways of thinking about budgeting that centers were having to do. And as a result, many centers were forced to close. This prevented progress in, obviously the childcare sector, but it also presented some downstream effects on the economy due to parents not being able to find childcare during that time. And that was a time where there was a need for people to be together, right? There was a lot of isolation, and so children missed out on social developmental opportunities. As I mentioned before, there's so many benefits to early childcare centers of high quality that present the ability to self-regulate around one's peers and one's teachers. If you are potentially experiencing an unstable environment outside of that center serves as a place of stability for you. And we know that the research points to cognitive and social benefits of being in a stable setting, even when the rest of the world is kind of in chaos. So I'll leave you with some highlights here that were discussed, obviously presented before, but just as a refresher, the takeaways are that there's a significant cost due to parental absences in the Louisiana, in the state of Louisiana and its economy due to missed work, turnovers, and other costs that we found in this policy analysis. The total economic impact could be up to 1.3 billion in the Louisiana economy. COVID-19 further exacerbated the quality and the stability that we could see in making progress towards, having a better balance for parents and employers through childcare. And we want high quality care to be linked to a stable workforce, but it continues to be a persistent issue where there's low pay, experiences of shortages and turnover that affect the quality of care in Louisiana. So I thank you for listening to this brief presentation on our policy brief. As I said before, I will link the policy brief to the chat. I also have my email address here for any questions that I'm able to answer, as well as anyone on my team. And finally, the Blanco Center website that we have here, you can sign up for the newsletter. So I'll go ahead and link that in the chat. And I appreciate your time.
All right. Thank you, Dr. Thibodeau. We actually do have a couple of questions that came through in the Q&A box and in the chat. So I am just going to read those off to you. The first question that we received is, for children who are receiving care but not with parents, who are they with, and what do we know about the quality of this care?
That's actually a really good question, and I think I can take that question back to my team to kind of look at these different categories. I mean, we know that it's kind of an assortment of different arrangements of care, being your, your family-based childcare. We know that there's private care, provided through different organizations, religious organizations that provide care as a way of lumping those into the category when it's compared to, at least that's what I read in the reports, what's compared to paid childcare. So that's a quick answer, but we can. There's probably a little bit more detail in the policy brief as well, and I could certainly. If you contact me and we'll get some back and forth, I can get some answers from Dr. Barnes, our executive director, as well as other members of our team.
Perfect. And also I see Mr. Mills from your team is also typing. So he may be answering this question via.
Eric too. Yeah, I think he'll be able to answer that as well. Thank you, Eric.
I see one of your colleagues jumping in. So yes, thank you for that. The next question that I see in the chat is from Cindy Sespiva. Hello, Cindy, in Sinla. She's asking, is all the data 2021 based? So all of the data that you presented, is it all 2021 based?
So much of it comes from the policy brief analysis that was done in the beginning. Some of those overall statistics were updated through that state's report to 2021. That's their most recent survey. The data that we did on economic analysis for the actual, turnovers, absences and so on and so forth, those are post 2017. I believe they're 2019 to 2020, so not necessarily all 2021 data. It's also important to note that in some cases, like with the state's report, that Louisiana did not necessarily report on every statistic, and those might be estimated from 2019 data. So they take 2021 and they report it, but they're weighting it based on the response that was given in 2019.
Perfect.
So it's not a nice and neat pattern, in other words, but it's some of it's 2021 based, some of it is a little bit earlier, 2019.
Thank you for the question. And then I see in the Q&A, there's a request for the link to the policy brief. So to all participants, we are going to provide all the recordings and the resources and the presentations after the symposium. And we'll definitely let you all know when it's available. So you will get a copy. Let's see, going back to the chat. So the chat box is cleared. Q&A is cleared. Also, I see our tech support is just reminding everyone, if you want to just unmute yourself and ask a question, just raise your hand. We will unmute you if you have another question.
I think I saw somebody did raise their hand, but maybe it went away.
No worries. Here we go. So I see Miss Sonia Young Bailey has a question. So Sonia, you can come off mute and ask your question.
Hello again, Candace,
Hello.
Dr. Weber. Hi, Dr. Thibodeau. The question that I have is, you're showing these stats on, I'm really concerned about the pay of the childcare providers. Coming from another state where, pay was pretty high for childcare providers, I'm wondering, what is the state doing to be able to aid in being able to aid in retaining these really good providers? Because we know that to become a good provider, you need to be one for over 3 to 5 years. So if we're losing everyone in 1 to 2 years, that's obviously affecting our quality of childcare providers. And if we're so concerned with how that's affecting the economy of Louisiana and all the other things as far as education and IQ and all these things that we've been talking about, what is it that we are actually doing well, and what is it that we need to do more of, or things that we haven't done that we need to start doing to aid that situation?
Ooh, that's a great question. So you should come a little and hear a little bit about our 1 p.m. session, where we're going to talk a little bit about some recent efforts with the Department of Education and the Blanco Center to run a randomized trial examining the role of supplementing teacher pay and increased teacher pay on retention. And we're familiar with, there's some other efforts from other states to try to look into this question, and that's contributed to an overall positive outlook for the role of retaining teachers, that you need this jump to have a meaningful difference. So we continue to do that, as well as work with the Department of Education to help them to budget seats accordingly to their centers, that it helps to, not only defray the cost to the state or help manage the cost to the state, but to those individual centers, right down to the seats. I know there's so many threads that are going on in Louisiana. I know Candace can probably even talk about at length. I'm sure she's going to have a great session as well, dealing to this topic. That there are local initiatives and efforts of different groups to look into the benefits that teachers receiving, and what impact it can have on their work. And hopefully, we're not too far from seeing those changes, but we know it's a long-term goal. I think I really appreciate that question, Sonia. It's a very, you have a great perspective on this, and certainly we want to keep working towards it with multiple efforts. But one that we are trying to do as a policy research institute is assist LDOE with thinking about teacher retention specifically.
Yes, and I also add to that. I mean, one thing, Sonia, that kind of like, what are we doing? We're really trying to help our policymakers and the public know just what early childhood is. A lot of people think it's just babysitting, that there isn't a curriculum, there isn't credentialing that happens. So part of it is really getting the mental shift and understanding that this is actual like learning. We sometimes have even intentionally changed how we talk about childcare in Louisiana. We call them early learning centers, not daycare centers. One teacher said at one point, we care for the child, not the day. I'm like, noted, and so it's just really getting people to understand that these children are learning. Also in Louisiana, at the Policy Institute, we have what we call Early Ed Month. It's the month of February every year, and we literally bring in the business leaders, we bring in policymakers into quality childcare centers so they can physically see what a quality childcare center is, the teaching, they can interact with the provider to really understand what it is. So I think that's one thing, hosting seminars like this. Like I said, we travel throughout the state, really trying to get policymakers in different communities to really understand what childcare is, so that, when we talk about teacher pay and increase, they are not thinking, oh, it's just babysitting. like why do we need to fund that, or why do we need to support that? And so that's part of the advocacy effort. And, like I said, we're on a trajectory really trying to strengthen that. And Louisiana, I will say, is probably one of the states, we're not the only state, but we're one of the few states that are really trying to be innovative in how we approach it. So again, plug for Dr. Thibodeau's session later on this afternoon, where he's going to talk about a pilot that was specific to teacher pay and retention in our childcare centers. I think that was in partnership with the Department of Education. So thank you again for your question. And I'm just curious, what state, you said you were in a different state where teachers had higher pay. What state are you coming from?
I've actually worked in several states. I was overseas in Germany for quite some time, and then I was in the state of Kansas and most recently state of Texas. I just moved here 2 years ago, and I was doing something else, and I wanted to become a childcare provider again. And I have to say, it has been very difficult just navigating the process. So I think that I don't think that you all know, but that might be part of the problem as well.
Got it. Thank you. Thank you for your question, and thank you for your passion as well. We need good providers and teachers. So please, if there's anything we can do to support or help you navigate that journey, if that's still something you're pursuing, please reach out. I'd love to connect with you directly.
All right. Thank you so much for that. Thank you.
Yeah. Another question in the Q&A box, Dr. Thibodeau from Yvonne Crummins. She says, are there any plans in the near future to embark on an updated study, considering this information is from 2019 to 2021, so basically the COVID year? So,
Right. The shock that happened with COVID may have made persistent challenges. I hear that question kind of in there as well as, COVID made some persistent issues more magnified. And so what do we see on the, hopefully on the other side? Well, I think we can point to, we certainly look at updating the work that we're going to do. We're continuing again to support the LDOE, but there's also, I should speak at large to the organization. The Blanco Center is pulling together a number of reports that are focused on anywhere between transitions in schools, so pre-K to kindergarten transitions and K to 12 transitions, all the way to economic outlook and jobs for the state of Louisiana, as well as the causes and consequences of criminal delinquency. And I say that all to say that this is part of a recent development in the Blanco Center's history, known as the LA First data system. And we are using, in collaboration with 9 different agencies across the state, we're using their administrative data to track longitudinally people over time through these different aspects of how they, look in terms of, the early investment in early childcare and what that projects in terms of their opportunities later on at the state level. This is in its infancy, it's in its beginning, but I think we're not only looking at drawing from, a specific, area that this policy brief is focused on and trying to link it to the general impact on the economy, but there's other impacts that we can analyze as well within, jobs. I heard through discussions with some of my colleagues here at the Blanco Center that Louisiana has had a jobs problem, a job stagnation since about 2015. And this is by and large due to oil and gas downturn, but it has continued to feel ripple effects throughout this period. So obviously COVID did present a shock to the system as well, but we will continue working towards these new policy analyses that look at, like I said, more causal data. That's data that follows people over time, and you can see what is setting up these conditions as well as what predicts certain kinds of outcomes for quality indicators. So it's a broader answer than perhaps the question wanted, but I felt like it, inspired to say that. So
Yes, and thank you for the question. Yvonne put thank you in her comment. Next question that I see in the chat says, if childcare is crucial to the economy, how can we convey its importance to businesses and encourage their involvement in supporting employees' childcare needs? What opportunities exist for businesses to assist their employees in this area? I kind of smile because I will talk about some of this in my next session.
I'm not going to steal your thunder.
So go right ahead, because folks they may join other
Well,
sessions, but go ahead.
That's true. Well, I mean, I'm also going to admit a little bit of humility with this topic because, as you may have heard in my background, I'm a developmental psychologist, not an economist. But I do, I look at this from obviously from a stability point of view. That developmental science is really focused on stability for the child, and so if businesses can invest in that child's stability, that is the most important thing, to me as well as a parent. And I know that there are lots of solutions that can be offered, but hopefully it's all in the name of, being able to see businesses that invest, maybe take the lead in investing this, are seen as real front runners, right? They're marked or designated as truly, organizations that think about their parental workforce and that hold the parents in mind so that they can hold their kids, right? That is the holistic kind of framework I like to think about it, is that it's not just, I love the fact that Candace said, what did you say? I'm not taking care of a day, I'm taking care of a child, right? But I think the thing that we need to kind of think about framing this as is holding the parents is also holding the children. And that's a message that, resonates in terms of thinking about all of the different spheres that influence the child and their development, all the way from their immediate interactions and what kinds of daily participation they get to do with within a child care center and how it benefits them, all the way out to those larger spheres of influence that don't have a direct impact necessarily on the child, but obviously as a system, it does have an impact. So thinking about it socio-ecologically, and how we can support those, parent-child quality interactions is the most important thing that businesses can do. And maybe that's going to take a while to change a narrative. Maybe we still have a narrative issue. I am not sure. And that's a long-standing change that needs to occur, that it's not just, a daycare, or I don't just send my kids to live, I'm gonna name their choppers. I love it. Little Oaks, love Little Oaks, and I know the value of Little Oaks, but maybe maybe all the parents and the businesses and the supervisors that they work for don't necessarily see that, right? I'm in a biased point of view. Nonetheless, I do think some changes in narrative will have to take place, and certain businesses may need to take leadership in that. So I think it's a great question.
Yeah, and I'll also add, so prior to coming over to early education policy and research, I came from the private sector, and in my role as chief of partnerships, that's exactly what I do. I go back to the businesses and essentially educate them on the economic impacts of childcare. So like with Jordan, that policy brief that he presented, was done in collaboration with the Policy Institute for Children, but really helping businesses understand, like, when there are breakdowns in childcare, their working parents can't come to work. I mean, we saw that it is a $1.3 billion impact to the economy, to Louisiana businesses themselves, helping them understand. It costs businesses $762 million annually when there's breakdowns in childcare. And then at the Policy Institute, we've also developed what we call a workforce business calculator, so that individual businesses, based on the data in Dr. Thibodeau's report, they can see how much breakdowns in childcare is costing their business specifically when their employees have to miss work, leave work, or whatever the breakdown is. And so it's really the educational piece that we go hard on, in addition to, as I mentioned earlier, the Early Ed Month, really going out and bringing the business leaders into the centers along with the policymakers. We have partnerships with a lot of the economic development corporations around the state chamber, local chambers. And so it's really, just that education piece, but helping when businesses understand how much money or how it impacts their bottom line, we've noticed that it tends to get their attention. And so we're just, we'll constantly use data and research that Dr. Thibodeau has to really hit the pavement and just educate the business community as well. So again, thank you for the question. And I see that Alex has put the link to our economic impact calculator in the chat. So thank you for that, Alex.
So just as a quick note, the policy brief, we have a team of people that focus on this work. And so I'm the presenter of this work. I am getting into this area of policy researcher as an early career researcher. And so I'm really thankful for, the policy brief was done in collaboration with Louisiana Policy Institute for Children, using their knowledge base, but also the people who are writing this work are, my director, other associates. So it really takes a team effort to understand the complexities of this, the nature of this. So I want to give credit to the team and their work here. I am a messenger.
Oh, you're more than a messenger. So I see the chat box is cleared, the Q&A box is cleared. We are getting close on time. So just want to say thank you to everyone for joining. Thank you, Dr. Thibodeau, for sharing your expertise. And so just so everyone knows, when this session ends, so the Zoom app will close out, but you'll be brought back to the event lobby, or if you have it on your homepage, you can go there. You will see a little notification badge to say, hey, you have a survey. Please provide feedback from this session. It takes less than 2 minutes. And I believe, again, you'll see a pop-up in the top right of your screen. So next session starts at 10:55. So in the meantime, feel free to hang out in the lobby, network with others in the chat box, or through private chat. If you have any additional questions, need assistance, again, our support team is on site and ready to help throughout the day. So thanks again for attending this session, and we look forward to seeing you in the next session. Take care, everybody.
Thank you.